Yeah, so I'm doing a lot of quality improvement work. So one of the things we're doing is tracking patients who come in with fragility fractures due to osteoporosis, usually undiagnosed osteoporosis. So a big issue is a lot of times patients come in with a hip fracture, say, and they have surgery done, hip replacement or something like that. They're optimized peri-surgically, but after that they're sent out for rehab. But there's no follow-up done. They don't get the routine bone density scan done. There's no discussion about treatment strategies like using a bisphosphonate or something like that to reduce the risk for future fractures. No discussion of calcium use or exercises or things like that to strengthen the bones. So now we're trying to work on tracking these patients who come in with fragility fractures when they come in, and then educating providers who are covering their care and trying to make sure that we hand them off when they go back as outpatients to their respective primary care doctors, so that the doctors are aware of the standards that we would recommend for managing osteoporosis and resources that they can look into to make sure they know how to handle the situation. So we're certainly doing that, spreading more information on A1C goals and TSH goals for managing diabetes and hypothyroidism, because those goals will change as people get older, and a lot of primary care physicians may not know the shifting goals when people become geriatrics. So we're working on that too. As far as like pure like research, I'm not currently involved in any research projects, but there certainly is a lot of stuff going on as far as kind of early detection of Alzheimer's. Right now, with dementia in general, we don't have cures for dementia. And by the time people become symptomatic, when they start to have cognitive and functional loss, it probably is too late to start treating them anyways, even if we did have a cure. So we're aiming in geriatrics to try to find ways to detect the presence of Alzheimer's and other dementias before the patient even becomes symptomatic. Because if we, hopefully ever develop effective treatments, we want to try to diagnose those people as early in the process as possible, essentially before they become symptomatic. So there's a lot of that going on, biomarkers in the blood or cerebrospinal fluid, so on and so forth, that, imaging, things like that, can we detect these patients, and then again, find a treatment that can cure them. Because right now, we don't really have anything to stop the onslaught. We can slow it down, but we can't stop it. So that's a big thing that's going on right now as well.